My name is Stephanie.
My name is David.
We have 3 children. We have 2 girls, 12 and 10, and a boy who is 8.
I worked in transportation for cars around the United States.
The economic crisis kind of took its toll, and they laid off a bunch of people, and he ended up being one of them.
Since I got laid off, I've been looking for work, and it's very hard. Nowadays, it's a lot of people.
Even with me working part-time at the school as the substitute, it's very hard.
Very hard.
It's very hard.
I think one of the biggest challenges in San Diego County is the perception that we're a very affluent area and that there isn't as much need in the community.
We do a universal food insecurity screening, and we've found over 70% of our patients have food insecurity, are skipping meals for entire days often. And then in our subset of diabetic patients, it's over 80% of our diabetic patients are food insecure.
My full name is Annette Marie Castro. I have 2 children. I work for the school district, and I'm a campus monitor. The doctor told me, "You have type 2 diabetes." I was like in shock. So he explained to me it was probably the way I was eating.
Healthy food tends to be more expensive food. Foods that are unhealthy are often far less expensive and available.
If you have very little money, even just the money to get to the bus and back home is really a barrier to getting to your doctor or getting to food.
I actually personally come from a military family, and I remember that struggle when I was younger, especially with being stationed in different areas of the country, with long deployments, with one spouse or parent being out of the country or away.
We face it. Gotta skip a meal, we gotta skip a meal. If I don't have anything in that morning to eat, what can I do? There's nothing.
The stress is always there. The motivation I have is my kids, so I have to bounce back.
Feeding America San Diego is bringing pantry items, canned food items that are healthy and nutritious to our patients.
We like to volunteer because we don't like getting handouts. We help out first, and we earn that box.
We get there at 6 in the morning, and we set everything up, and we're there until the food's gone. The children I know wouldn't have as much energy. I mean, my kids play multiple sports, and with the fresh fruits and vegetables, they would be constantly in the hospital sick, and I'm lucky enough not to have that problem.
The challenges that I face, transportation, the means to getting to the store, skipping meals due to not enough income. But if I had my box.
We've done the food box program for several months now.
Bringing food into the patient's clinic and teaching the doctors and the patients that food is medicine is very innovative, and I think the wave of the future.
In the back of my mind, I know what's good for me, but with them showing it, having on hands, is a whole different concept.
People get excited about the food from Feeding America that we're giving to them. We actually have heard families in the line call their friends, "You should come out here, we have some really good stuff this week."
The connection between food and health is very simple. You can't have one without the other.
So if you think that food isn't medicine, you're really missing the boat. You're missing the number one killer. You're missing all the things that cause the biggest morbidity mortality in our country. And I think enabling them to take better care of their families really does break the generational poverty cycle.
The nutrition education that I've learned has helped me quite a bit because I pass it on to my husband, to my daughter.
Any of us might know someone who is in need of food assistance and hasn't told us. You know, hunger can affect anyone. There's no one face of hunger.
I was always working and always, had everything we needed for the kids, and all of a sudden we had a down.
I would say our patients are the hardest working people that I know. They're not asking for handouts. They don't want handouts. I've been their doctor for 10 years and they've never asked for a handout. And when I start asking them, interviewing them about being in the study, and asking them how often they eat fruits and vegetables and how often their kids eat fruits and vegetables, they just start crying. And they've never brought it up to me before. All these 10 years I've been taking care of them as their doctor because they're ashamed that they don't have healthy food for their kids And they work so hard. They get up at 4 in the morning, or they work all night long, and they're doing everything they can. But the fact is, raising a family on minimum wage in San Diego is impossible to provide healthy foods.
We decided that it would be a good idea for me to go back to school. I went and got my bachelor's in healthcare administration in June of this year. One thing I would like to hope to do with my degree is to not only increase the income of the household, but also to be able to help those in need.
This program is extremely important to members of our military and their families. It gives our service members the peace of mind that they know that someone is there to take care of them, gives them the peace of mind that it's okay to ask for help if you need it.
Take care of people with heart attacks, with cancer, and the thing that people remember most and talk about most is that I brought food to their clinic, that I worked with Feeding America to bring food to their clinic. That's the thing that's most memorable to them because it's a fundamental human need. You need to eat and drink and sleep. And if you can't do those things, what difference does it make what else I'm doing for you?
It is amazing to see the change in someone's face when they've come desperate, scared, intimidated about asking for food. Once they're leaving with a bag of food, the relief that they're experiencing is amazing. And thank you so much for what you do.
Continue your good work because you are helping those that have diabetes. Thank you.
People should come together when your neighbor needs. I just want to tell that person, whoever's helping us do these food pantries, thank you from the bottom of our heart. Thank you.